Hi there, myself Dr. Mariam. Before we dive into the specifics of hepatitis, I want you to know that this topic will be a bit lengthy, so I'm sure you don't skip any of the points. So let's get move on to the topic. Introduction. Hepatitis. So what is hepatitis? It is a inflammation in your liver. The inflammation is your body's response to an infection or injury. Many things can injure your liver and trigger hepatitis. Certain viral infection cause hepatitis, but you also can develop it if you have diseases that affect the liver or you are exposed to toxins like chemicals, alcohol, and drugs. The word hepatitis comes from the ancient Greek word hepa, meaning liver, and the English word itis, meaning inflammation. So this is the basic intro of what is hepatitis. Classifications. So there are several type of hepatitis. Each type can be acute or chronic. Sometimes are more common than others also. So it is divided into these, that is viral, bacterial, toxic, and drug induced, alcoholic, and autoimmune. So these are the four classifications. So we'll discuss further explaining each type. First one, viral hepatitis. So viral bacterial hepatitis, it is the most common type of hepatitis worldwide. The most common causes of viral hepatitis are the unrelated hepatrophic viruses like hepatitis A, B, C, D, and E, and other viruses can also cause the liver inflammation, including Epstein-Barr and Epstein-Barr virus and cytomegalovirus. So this is what the viral type of hepatitis. And coming to the bacterial infection of the liver results in pyogenic liver abscesses, acute hepatitis or granulomatous chronic liver disease. And pyogenic abscesses is due to the Escherichia coli and Klebsiella pneumonia. And acute hepatitis is Neisseria meningitis, Neisseria gonorrhea, etc. And chronic or Mycobacterium granulomatous is Mycobacterium species, and Treponema pallidum and Rickettsia species. So these are the bacterial type of liver this hepatitis infection, bacteria caused hepatitis. Moving on to the toxic and drug induced, chemical agents and medications, industrial toxins, and like herbal and dietary supplements are other causes of these hepatitis. And spectrum of drug induced liver injuries varies from acute hepatitis to chronic hepatitis to acute liver failure. So mechanism of injury includes direct cell damage, disruption of cell metabolism, and causing the structural changes. So this is what happens in the under the drug toxic and drug induced hepatitis. Moving on to the alcoholic hepatitis, it is due to mainly because of the excessive alcohol consumption within the spectrum of alcoholic liver disease, and it usually develops over years and due to the like usually over years, like within many years. If the exposure of alcohol is too much, then that can cause alcoholic type of hepatitis. The risk factor is because of the quantity and duration of the alcoholic intake. So if an individual is taking alcohol for a too long time and too much quantity per day, then that can cause a alcoholic hepatitis. Next is autoimmune. So autoimmune, it is a abnormal response against liver cells called the leukoid hepatitis. So it autoimmune is a chronic disease caused by an abnormal immune response against the liver cells called this leukoid hepatitis. It occurs when the body's immune system attacks the liver cells, causing the liver to be inflamed. The affected people are often positive for human leukocyte antigen with circulating autoantibodies, which help in diagnosis. So this is what the autoimmune classification of hepatitis. Moving on to the stages of hepatitis infection. So stages of hepatitis infection, The various clinical patterns and pathological consequences of different hepatotrophic viruses can be considered under the following headings, that is the carrier state, asymptomatic infection, acute hepatitis, chronic hepatitis, and fulminant hepatitis. It is fulminant hepatitis or submissive to massive necrosis. We can call these. So these are the stages of hepatitis infection. That is the carrier, asymptomatic infection, acute, chronic, and fulminant or submissive to massive necrosis. So these are the stages of hepatitis infection. So we'll discuss one by one further. Coming to the carrier stage. So it is an asymptomatic individual with manifesting disease, harboring infection with hepatotrophic virus and capable of transmitting is called as carrier state. So hepatitis A and E do not produce the carrier state, and hepatitis B is responsible for the largest number of carriers in the world. So this is what in the carrier stage. And coming to the asymptomatic, these are the cases who are detected incident to have infection with one of the hepatitis viruses as revealed by their raised serum transaminases or by detection of the presence of antibodies but are otherwise asymptomatic. So this is what are in the asymptomatic stages. Moving on to the acute and chronic stage. So in acute hepatitis, the most common consequence of hepatotrophic viruses is acute inflammation involvement of the entire liver. In general, type A, B, C, D, and E run similar clinical course and show identical pathological findings. So clinically, acute hepatitis is categorized into 4 phases: incubation period, pre-icteric phase, icteric phase, and post-icteric phase. So in incubation period, it varies among different hepatotrophic viruses. The patient remains asymptomatic during the incubation period, but the infectivity is high during the last days of incubation period. In pre-icteric phase, this phase is marked by the prodromal constitutional symptoms, and the earliest laboratory evidences of hepatocellular injury in pre-icteric phase is the elevation of the serum transaminases. In icteric phase, this phase is commenced by onset of clinical jaundice and the constitutional symptoms diminish. Other features include dark colored urine due to bilirubinuria, clay colored stools due to cholestasis, pruritus as a result of elevated serum bile acids, loss of weight, and abdominal discomfort due to enlarged tender liver. This is what happens in the icteric phase. Post-icteric phase, that is the last phase, the icteric phase lasting for about 1 to 4 weeks is usually followed by a clinical and biochemical recovery in 2 to 12 weeks. The recovery phase is more prolonged hepatitis B and hepatitis C. So this phase is more prolonged, we can see in the hepatitis B and the hepatitis C conditions. So this what is the incubation period of acute hepatitis. And moving on to the chronic hepatitis. So chronic hepatitis is defined as the continuing or relapsing hepatic disease for more than months. So majority of cases of chronic hepatitis are the result of infection with hepatotrophic viruses like hepatitis B, C, and combined hepatitis B and hepatitis D infection. Chronic hepatitis may progress to scarring of the liver, that is the liver cirrhosis and liver failure, and also the liver cancer. So this is what happens in the chronic stages of hepatitis. Moving on to the last stage, that is the fulminant stage. So fulminant hepatitis, it is from submissive to massive necrosis. So it is the most severe form acute hepatitis in which there is a rapidly progressive hepatocellular failure. There are 2 patterns: submissive necrosis, massive necrosis. In submissive necrosis, having a less rapid course extending up to 3 months. In massive necrosis, in which the liver failure is rapid and fulminant, it is occurring in the 2 to 3 weeks. So this is what happens in the 2 patterns, that is submissive necrosis and massive necrosis. So this is what the stages of hepatitis, that is the first stage is carrier state, then asymptomatic, then acute hepatitis, chronic hepatitis stage, and the last stage is fulminant stages of hepatitis infection. Now we'll discuss individually the, as I've mentioned, the viral hepatitis divided into the following, that is hepatitis A, B, C, D, and E. So individually we'll see the types of these are the actually in this we have to more concentrate about the each type of viral hepatitis. It is A, B, C, D, and E. So we'll discuss individually what are their etiology, clinical features, diagnosis, and what are all things to be done to prevent the hepatitis, and how to manage the conditions. So first one is hepatitis A. The etiology is the cause due to the hepatitis A virus. The incubation period is from 15 to 50 days, and it is a RNA virus of enterovirus family. So this is the broad short intro of hepatitis A. Coming to the causes. So what causes hepatitis A? Consumption of contaminated food, staying in large crowd of people, swimming in dirty waters, household contact with the sick, use of contaminated water, use of non-sterile syringes, sexual contact with a sick person. So these are the causes of hepatitis A. And how it is transmitted? Through the fecal-oral route due to fecal contamination of drinking water, close contact with the infected person, transmission possible with the oral anal contact during the sex. So this is the mode of transmission of hepatitis A. What is the pathophysiology? So how hepatitis A virus enter in the body and how it is caused. Hepatitis A virus invade the body, and the multiplication occurs in the intestinal epithelium, and after the multiplication it reaches the liver by intestinal epithelium and replication within the liver cells, and it enters the intestine with the bile and appear in the fecus. So this is how the physiology goes in the hepatitis A. And what are the clinical features we can see those who have diagnosed with hepatitis A? First one is reduced appetite, jaundice, fever, dark urine and pale stool, pain in the right side of the abdomen, digestive disorder of diarrhea, joint pain, weakness and fatigue. So this is the clinical features we can see in the hepatitis A diagnosed patient. And how to diagnose it? We have to do the history, physical examination, medical history, general health history, surgical history, and medication history, etc. Family history also. Due to many of the is medication, lifestyle history, lifestyle habits also, there can be a cause to get infected with hepatitis A. And we have to do physical examination, detection of antibody, and enzyme linked immunosorbent assay, anti-HIV IgM in acute infection, and we have to do anti-HIV IgG for recovery and immunity to virus. Biochemical test like bilirubin, protein, alanine, aminotransferase, stool examination should be done to diagnose this hepatitis A condition. Moving on to the management. Initial, we have to do advise bed rest, proper diet. In anorexia, small frequent meals and supplemented with IV fluids with the glucose is prescribed. No medicine or treatment to make it go away. Most people recover completely, and routine vaccination, 2-dose series, hepatitis A. Haveric 6 to 12 months apart, or 3-dose series, hepatitis A, hepatitis B, that is Twinrix at 0, 1, 6 months and 2, 5 months between doses 2 and 3. So this is how to manage the hepatitis A. And how to prevent this hepatitis A? The vaccine, the patient have to get vaccinated. Wash fruits and veggies before having, wash hands before having food, cut nails to short, clean drinking water, take the prescribed drugs on timely manner. So this is what the hepatitis A. Next is hepatitis B. It is also known as serum hepatitis. The etiology is caused due to the hepatitis B virus HBV, and the incubation period is 48 to 180 days. It is a double-shelled DNA virus of enterovirus family. So this is the short intro of the hepatitis B. How it is caused? It caused due to the maybe because of the direct blood-to-blood contact with the individual, mother to child during birth, maybe through the tattoos, piercing, barbers, scarification, circumcision practices also, maybe because due to these practices household contact with the sick, use of non-sterile syringes, household contact, and sexual contact with the sick person. So these are the causes of hepatitis B. Moving on to the pathophysiology of hepatitis B, the same as like hepatitis A, the hepatitis B virus also invade the body. Multiplication occurs in the liver. There can be hepatocellular injury. Inflammatory cells infiltrate into portal tracts. Kupffer cell hyperplasia will be present. Cholestasis and leads to regeneration. So this is what happens in the pathophysiology of hepatitis B. Next is the clinical manifestation. So what are the clinical features which we can see in the patients who have diagnosed with hepatitis B? Reduced appetite, jaundice, fever, dark urine and pale stool, abdomen pain, digestive disorder of diarrhea, weakness and fatigue. And how we can diagnose it? Same as like history, physical examination. You can advise serological test like enzyme linked immunosorbent assay ELISA. Hepatitis B surface antigen present in the blood indicated acute or chronic state. Antibody to HBsAg detected in serum during late convalescence indicate the recovery or development of immunity. And we can do biochemical tests like total and direct bilirubin, prothrombin, total protein, albumin, serum globulin, CBC, coagulation studies, aspartate transminase, alanine transminase, and alkaline phosphatase. So this is how we can diagnose the hepatitis B. And how we can manage it: bed rest, psychological rest, adequate nutrition, drug therapy, alpha interferon IV TDS to decrease inflammation, antiviral drugs like lamivudine, epivir HPV, and idefovir, dipivoxil, hepzira orally, immunomodulating drugs, oral ribavirin, virazole, and you can, in case of vomiting, to control vomiting, antiemetics can be prescribed. Immunization: Enagrix B 1 ml 20 mcg IM at 0, 1 and 6 months. Recombivax HB 1 ml 10 mcg 1 m at 0, 1 and 6 months. Heplisav B can be used as a substitute in a 3-dose series with a different hepatitis B vaccine. And in 2-dose series, Heplisav B aged greater than or equal to 18 years, you have to give 0.5 m IM at 0 and 1 month. So this is how we manage the hepatitis B condition. And how to prevent it: healthy lifestyle, use condom during sex, vaccination, personal hygiene, do not pierce or tattoos in a questionable place. So wherever there is like for example the private areas or belly button, etc. So do not pierce or tattoos in these questionable places, and avoid stress and use sterile syringes while doing any or undergoing any procedures. So this is what is the hepatitis B. And next is hepatitis C. The etiology is hepatitis C virus. The incubation period is 14 to 180 days. It is a self-limiting and it resolves within the 4 to 6 weeks. And the mode of transmission is same as hepatitis B. And what are the causes of hepatitis C? With the it can be caused during with the donor blood transfusion time, during surgeries, pregnancy from mother to fetus, sexual contact, use of non-sterile syringe or needles for injection or any other procedures, during childbirth, complications of an infectious or bacterial disease due to syphilis or leptospirosis, etc. So these are the causes of hepatitis C condition. And moving on to the pathophysiology, the hepatitis C virus is carried in the bloodstream to the liver. It affect and damage the liver, and it also affect the other parts of the body such as digestive, nervous and immune system. So this is what happens in the hepatitis C condition. About the clinical manifestation or the clinical features, we can, in the hepatitis C there are two phases: acute phase and chronic phase. So acute phase in the first 6 months, so symptoms are not present in this case. Maybe we can see jaundice. And in chronic phase we can see it this chronic phase will last for longer than 6 months and will be mild or no symptoms. Then there can be loss of appetite, intolerance of alcohol, pain over the liver, like pain on the right side of the abdomen, jaundice and depression. So these are the clinical features in the acute phase and the chronic phase of hepatitis C. How to diagnose? Same as before, the history, medical history, general history, health history, lifestyle habits, etc. Physical examination, detection of the antibody, ELISA, anti-HCV antibody in acute infection, PCR to detect viruses, LFT, liver function test, USG, liver biopsy, does not provide immunity, and these does not provide immunity to the virus. So these are the diagnostic techniques you can do to diagnose the condition hepatitis C, and how to manage it. So the main aim of the treatment is to clear the HCV virus, that's the hepatitis C virus, from the body, and to prevent the serum damage leading to cirrhosis, liver cirrhosis. So the treatment consists of the combination of two different medicines like PEG-related interferon, that is PEG interferon, ribavirin, which fights the virus, liver transplants for advanced liver cirrhosis, and you can advise to avoid alcohol and follow a good diet. So this is how we can manage the hepatitis C condition. And how to prevent it: avoid sharing any injecting equipments like sterile needle, non-sterile needles, or syringes, etc. Practice a safe sex. Avoid sharing personal items that may be contaminated with blood, for example razors, blades, etc. And during the blood transfusion, donor screening for blood and tissue products should be done. And no vaccine exists for HCV. So there is no vaccination for hepatitis C. So you can't take any vaccination or get vaccinated for hepatitis C. So this is the hepatitis C. And coming to the hepatitis D. So it is also known as a delta virus, and the etiology is due to the hepatitis D virus. The mode of transmission may be through the blood or body fluid as with the hepatitis B virus, and the incubation period is 14 to 56 days. Next is the clinical manifestation. So what are the clinical features you can see in the patient who is diagnosed with hepatitis D? Symptoms of hepatitis B is similar to hepatitis D also: jaundice, joint pain, abdominal pain, vomiting, dark urine, fatigue, and loss of appetite. Diagnosis as of same: history collection, medical, physical, lifestyle, etc. Physical examination of the body, detection of the antibody, enzyme linked immunosorbent assay, anti-HDV antibody in acute infection, liver function test, and does not provide immunity to virus. So these are the diagnostic techniques you can do to diagnose the condition hepatitis D virus, hepatitis D viral condition. And next, moving on to the management. Currently, no known treatments for acute or chronic hepatitis D. Chronic hepatitis D virus treated with alpha interferon in practice, and you can advise antiviral medications, which do not seem to be very effective in treating. So you can advise, but there is no very effective in treating the patient who's having a hepatitis D by prescribing an antiviral medications. Next, how to prevent this? Preventing, like I have mentioned, what are all things you have to do prevent the hepatitis B virus. So what are all, by preventing the hepatitis B virus, you can also prevent the hepatitis D virus. So in this case, vaccination for hepatitis B can help you to prevent the vaccination, help you to prevent the getting infected with the hepatitis D virus. So, and also you have to take the standard precautions and avoid contact with the infected blood, contaminated needles, and infected persons, and with their personal items like razor and syringe, needles, etc. And there, as I've mentioned, no vaccine exists for the hepatitis D virus. So this is the this is what called as hepatitis D. And moving on to the last type, that is hepatitis E viral hepatitis. The caused due to the hepatitis E virus. Etiology is hepatitis E virus. The incubation period is 15 to 60 days. It is a self-limiting and it resolves within 4 to 6 weeks. And it is more severe in pregnant women, especially in the third trimester. So pregnancy, you can check for this hepatitis E, especially in the third trimester pregnant women. And what are the causes? So causes: consumption of contaminated food, staying in large crowd of people, swimming in dirty waters, household contact with the sick person, use of contaminated water and use of non-sterile syringes, sexual contact with a sick person, and eating raw shellfish. So these are the causes of hepatitis E. And what are the mode of transmission? So it is due to from the fecal-oral route due to fecal contamination of the drinking water, and indigestion of products derived from the infected animals, and food handlers infected with the virus, and through the vertical transmission from pregnant woman to the fetus. So these are the four types of mode of transmission where the hepatitis E transmitted from one another. And coming to the clinical features, the similar features which I have explained under the hepatitis A infection is same here also. It's applicable: jaundice, anorexia, hepatomegaly, abdominal pain, tenderness, nausea, vomiting, and fever. How to diagnose? The history taking, physical examination, detection of antibody, enzyme linked immunosorbent assay, anti-HEV antibody in acute infection, and once infected with HEV, the person is immune to virus. So this is the diagnosis of hepatitis E infection. And how to manage it: immunoglobulin immediately after exposure within the 2 week of exposure. It is self-limiting, so no treatment required. Hospitalization is required in case of fulminant hepatitis and for infected pregnant women. So as I have explained the stages, under the stages of hepatitis infection, I have explained about the fulminant, that is submissive and massive necrosis. So in cases of these, hospitalization is required, and for the infected pregnant woman cases also. Avoid alcohol, and symptomatic treatment of flu like illness can be given. So next is how to prevent it: use bottles water for brushing teeth in high risk areas, use purified water for washing vegetables or anything while cooking, or avoid raw meat and boil water to purify it, and wash hands frequently. So this is how we have to prevent it. So as I've discussed with you about hepatitis A, B, C, D, and E, you have noticed that majority of the clinical features, causes, and mode of transmission is almost similar, and even the symptoms also almost every, like, when you read it, when I was telling you might have felt boring because everything seems to be same. But the only thing it differentiate is the how well you diagnose the condition, because there are few things with the diagnosis we can make sure we can diagnose it whether it is a hepatitis A, B, C, D, or E. So the clinical features may be same, you cannot differentiate maybe sometimes, but while doing the diagnosis of the patient, make sure you diagnose it correctly, on point. So this is what the hepatitis. And what are the complications of hepatitis? The more complication which leads to cirrhosis of the liver, fibrosis, portal hypertension, liver failure, and liver cancer, glomerulonephritis, and also these are the complications of hepatitis. And so this comes to the end of our topic, hepatitis. I hope you don't mix up the things. I think you have noted the points and about each type of hepatitis, and about the different types, viral, bacterial, and all the classifications, and about the stages also. I think you have got the idea. So thank you. So this is the end of our topic.